Hi, this is Dr. Varisa Perlman with La Petite Creme with our podcast, Beyond the Diaper. This is a space where we talk about medical issues within the context of motherhood and self care. My special guest today is Dr. Sandra Doman, who is a chiropractor in Miami. And we're going to talk a little bit today about ideas of what chiropractic is, so people who are unfamiliar, and also what someone who was pregnant, a family kind of going through raising a baby, what are concerns that we have where understanding your posture and your balance can be really important. Welcome.
Thank you for having me, Doc. Good to see you.
Absolutely. So tell me a little bit about what when I say, if someone came up to you and said, what is chiropractic care? What would you say?
A chiropractor is a physician level trained practitioner who is a specialist in neuromusculoskeletal diagnosis and treatment. And we do that all without pharmaceuticals. So we are trained in diagnosis, which can include imaging and blood labs. We're a direct care provider, so you can come straight into a
Mm-hmm.
chiropractor to be managed.
Mm-hmm.
And from there, chiropractor, it literally means to do by hand. So by the time we have a diagnosis, our cure and our solution is going to be done by hand. So that's anywhere from a variety of spinal adjustments, manual therapy, different types of physical therapies, nutrition,
Yeah.
stress relief, and of course, we co-manage with medical physicians as well.
Wonderful. Okay, great. So then, we are probably speaking to a population of women who are either expecting or have children and parents who are taking care of children. What are ways in your practice that you see families and you're like, huh, you should think about this? And why is that important?
So I can speak specifically to pregnancy and postpartum, and I treat babies as well, but my wheelhouse is definitely pregnancy and postpartum. So if you can picture a woman's body and the way that it expands mechanically and
Mm,
physiologically in the 40 or 42 weeks of pregnancy,
right.
there can be a lot of compression and imbalance that makes not only the mom uncomfortable for the duration of the pregnancy, but it can also create compression and imbalance affecting the position of the baby, which
Okay.
can play a factor when it comes not just to development, but delivery. Um,
Yes.
so someone like me, I'm Webster certified, so I can help do gentle sacropelvic balancing. So the mom not only has a totally painless and comfortable 40 weeks, but they also have the
Mm.
delivery that they're hoping for and a good postpartum as well.
Yeah, I love this idea of not only dealing with things where until they, we will only deal with it when it hurts. And trying to say, like, what are ways that we are living and breathing every day and sitting in your situation or standing? What are ways that those movements kind of like mess us up or help us? Because I think that by the time that you kind of feel like it hurts, we're stuck in a corner. There's not as many options. So, if you had a mom who was coming to you and was like really concerned, wanting to kind of like have, a flow, kind of that their body would flow well and that everything would go in the right way, what are things that you would ask, that every woman should ask who becomes pregnant about their daily life that could be either helping them or hurting
So at least in this culture today, the first thing that I'm going to ask is how much the mom has been sitting, and if they have spent the previous
them?
decades sitting slouched in front of a computer,
Mm-hmm.
because I'm automatically going to know that she has compression through the sacrum and the low back, and even more importantly, all of the nerves and all of the blood flow that are feeding into the pelvis and the uterus. So I'm always going to ask about sitting because that's a mom who's going to have sciatica and pubic bone pain and what they
Mm-hmm.
call the normal low back pain of pregnancy.
So before they even have that pressure, you're like you're a bit of a setup, right? Because it's not just now, it's like the last 10 years. How
Yes.
have you been how have you been actually like allowing your body to be
Hmm.
is impacting how you carry that pregnancy is what I'm
Very
hearing,
much. Very
right?
much. very much.
So if there's a woman here who's not quite pregnant yet, thinking about doing it and making sure that they have, kind of their ducks in a row, how should they be sitting? Or how much should they be sitting?
So my feeling on sitting is outside of maybe like a standing desk, sitting and cell phones are here to stay. And I don't even stress about it because I'm very grateful for digital media. I am very, very biased towards sitting on your sitting bones at the tip of the chair
Mm,
and using your back and hip muscles to work in some capacity all day because there's no amount of core and abs and Pilates. They're going to
mm,
rebuild and undo 40 hours a week,
mm-hmm,
every week, over a decade and decade, the deconditioning that and compression that comes into the body. So I always encourage patients to sit at the tip of the chair, allow their back and hips to work in different intervals during the
mm.
day, and then also keeping the hips, knees, and toes straight in front of you when you are sitting or driving instead of
Ah,
crossing your legs and
oh,
twisting your pelvis, or even worse, when you have your knees splayed out to the side, stretching and weakening your pelvic floor,
okay.
right? There's no amount of Kegels that are going to pull that back in.
So sitting straight forward with your knees touching practically, right? Kind of at the edge of a seat, right?
Yeah, yeah. And
Right? Is really what we're
approximating,
talking about, right?
yeah, keeping the whole structure of your body approximated in a neutral type position. So the muscles are going to do what they're designed to do, which is to activate and stabilize for most of the day. And when you're in some sort of
Mm,
comfortable, stable neutral, you're not going to have sciatica that comes from crossing your legs and standing off to one side. You're not going to have pubic bone pain. You're not going to
mm.
have sneeze and pee because all the things that we have been told are normal that are not normal, and they're not only
Yes.
painful but they're uncomfortable and they're kind of like embarrassing for the mom, like especially after delivering and women are like, oh, my pelvic floor was never the
Mm-hmm.
same, as they sit with their legs kind of splayed out
Mm-hmm.
or crossing their legs. That's not normal aging for a young female body.
Well, it's interesting that you described the pelvic floor because, when you work with a French company, you speak to anyone French. And I just spoke to a midwife who had worked in France. The idea of pelvic floor health is so obvious to the French culture for whatever reason. And in the US, I mean, I even as a healthcare professional, don't really understand what that is. I do know that it is, again, a running joke amongst the things that pregnancy does to a woman's body, of this idea where a woman's ability to hold it or to not have any issues with incontinence is like assumed you're going to have those problems.
Yeah.
And it's
Yeah.
pretty, like you said, I think it's kind of awful that we've kind of left women to be like, yeah, we know there's a lot of stuff that happens that's bad, but we're not going to really, we don't have great treatments for it. Like you said, like you can Kegel all your life, but like if you, for the last 10 years, have been sitting a certain way, you're literally losing muscle. And from what I'm hearing from you, you're almost like losing muscle tone because you're not activating the muscles that are keeping everything the way it should be. Is that fair?
Yes. Yes, that's accurate. I believe that to be accurate. And then my feeling on, like you said, it was a French midwife. Okay, so I had the wonderful privilege of living abroad in Italy in college,
Mm,
and I got to experience all different parts of living in a different Western culture per se. And what that has given me is the ability, even now living here as an American in the US, the idea that when I come across information across um, American medical and or holistic pathways, the first thing I think is, what are they doing in Italy? What are they doing in
yeah,
Japan? What
yeah,
are they doing in Brazil? And the
yeah.
nice thing about practicing in Miami is my almost my entire patient base is from all over the world and of course
Hmm.
New York. for some
It's,
reason,
which
and
is like a
and
nation to itself, but
and, and which is a nation unto its own people.
yeah, yeah.
And what I hear from my Russian patients and my Colombian
Mhm.
patients is that most of the world is well integrated with both pharmaceutical as well as drug-free modalities, except for the US. So
Mhm.
I think that we have put an unfair expectation on the medical doctors in the US to consult and be the experts on everything that they are not trained in. So
Yeah,
if I have a medical question, diagnostic, and I have a pharmaceutical, a pill, needle, scalpel, I'm going to ask a medical doctor because that is their wheelhouse.
yeah,
If I have a question about weight loss or exercise or other, I'm going to ask somebody who's trained in that one area. I think where we
yeah,
run into a sticky situation here in the US is that we have marketed the pharmaceutical establishment as being better and or superior to non-drug
hmm
options,
hmm
and we're doing a
yeah,
disservice, not just to the patients, of course, but also the providers, because we're saying,
hmm
hey, listen, I know you have training in this one area. Why are you not functional medicine? Why do you not know about nutrition? Why do you no? Because I know this one thing.
yeah. And I think, as someone who's gone through a conventional medical system, but then actually came out and also did some postpartum doula training, has also done health coaching training, you know, all of those things are not part of my conventional training, right? And I did those things because I agree with you. I think that there's a lot of grace that you have that like the medical doctors should not, kind of like should not have to be responsible for all those elements. My beef, as someone who's in the conventional system, is that I find that the conventional world will say food doesn't matter, nutrition doesn't matter. Like, how you sit, that doesn't really matter. Right. And what I have a problem with, it would be a different situation. And I really do envy other countries that I feel like there's a better kind of mesh between conventional and traditional medicine, right? Because I would rather the doctor say, you know what? It's super important. You're absolutely right. It's super important. These are the people I work with. This is the team I work with that even better are in my office. And we can make an appointment so that you can see them. Or there's parts of what they say first. Let's try that first. Like being able to be in an office where there was an acupuncturist or nutritionist, having people or homeopath, I could take little
Yeah.
pieces from that and at least
Hmm.
start the ball rolling, right?
Hmm.
Versus what I get the sense of is that if there's something that the conventional world cannot monetize, honestly, cannot put into a number, can't put into a diagnostic test, they dismiss it.
Correct.
And
I
in
agree.
that dismissiveness, we are literally cutting out years, moments, chunks of preventative care because we're all focused on disease, treating something versus preventing something.
Hmm.
And the pharmaceutical, again, if you can't monetize it, you can't put it's useless because who can benefit from it? The patient benefits from it because then they never get to the pill. They never get to the point where they need that diagnostic test. And that to me was the dissonance as I would like to think as a healer, right? If you are a healer, it doesn't mean that you're always late to the party. A healer, oftentimes at best, just you never even get the invitation, right? You never you get that is to
Yeah.
me where I call traditional medicine. So I call it Chinese, but it came first in
Yeah.
my mind. So like I
Yeah.
call it traditional medicine
Yeah.
because,
Yeah.
that kind of idea of like, don't just concentrate on, I have back pain because I'm pregnant.
Hmm.
Sit there and try to figure out, how did I get there? And it isn't
Hmm.
just because you were pregnant, like you're saying, it's also those 10 years that you just didn't use muscles that were kind of waiting to be used and just didn't realize that you still needed them. And even when you sit like that, I mean, I was just doing it just now, you breathe better. Like, your whole element of your flow of your body feels different.
Hmm.
But we're just starting to understand how those measures on that every day
Mhm.
they're just not as sexy as like some big thing that comes at the end. But
Yeah.
what we've seen is that, at least myself, I've seen too, I'm sure you have, sometimes those big heroic things at the end don't work
Mm.
that well.
Yes.
So, this is the rub, right? This is the issue I have,
Yeah. 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 My feeling with, the way that we're raised in the US, again, unlike all the other countries, is that I hate to call it health because it's really disease care.
Yeah,
If
totally.
there's a health issue, only one person with a certain credential can help you, and that the solution is outside of your own body. Whatever you do, don't trust your own body because that's dangerous.
Yes.
Right? So we're
No,
we're raised we're raised into this system where like the doctor's
correct.
gonna come in and is gonna save you
Yeah.
and has all the remedy. Okay. Um, I just I think that I know that because of social media. Again, I'm a
Mm-hmm.
huge fan of digital media.
Mm-hmm.
Because of social media, the providers now, if you want to stay relevant, have to play nicely in the sandbox together
Mm-hmm.
in a collaborative team.
Yes, I
And that
agree.
is what is being forced. You already said the magic word, which is money, to follow the money,
Yeah.
which is if you want to keep patients and you want to stay relevant and you don't want to get phased out, you're going to have to learn how to play nicely with other providers because the
Mm-hmm.
patients are now demanding it.
Yes.
Um, and then even on the evidence side, I was thinking about this morning. Like if there's a doctor who's saying that chiropractic is dangerous or ineffective, my
Mm.
concern is not for the patient. My concern is letting the patient know that their doctor is not keeping up on their own medical journals. Like,
Yeah, yeah,
is that really a doctor
yeah.
you want to see in the first
Right,
place? Here, let me send you to
right.
somebody else.
Right, right. And I think that, we are just trying to make broad generalizations, and it's more comfortable that way, whether it be what care an individual needs and listening to their needs. And also, like you said, individual practitioners. There are some of both of our fields that we wouldn't go to ourselves, right? So, and that's okay. That exists. Those are people, right? But in the end of the day, overall, the thought process of trying to work in a collaborative function benefits patients, period. There's just no question, and so I love this kind of push that you have for people trying to examine the way they sit, right? What are other things that you look at, the way you sit? What are other things that kind of like jump
Uh,
out at you that give you a good kind of like picture of where someone's, kind of health is from your
yeah.
perspective?
So, how people sit is a big one. How people stand is a big one.
Okay.
I call it the thinking leg. So everybody stands off to one side.
Mm,
And that takes the entire structure of the body and all of the soft tissue around it and loads it down on one side of the body.
okay.
I call them also flamingos. They also stand off to one side. That's like the orthopedist's dream. It's like not using one side of the body, and then over 40 years, the other side of the body has to work too hard. That's the hip that's too tight. That's the sciatica side. That's the hip replacement and the knee replacement side.
Mm,
And you could do all the chiropractic, all the physical therapy, all the Pilates massages, all the things. But if you're still only standing off to one side, you're chronically loading one side, and the structure it's just not going to hold up over the many decades. So I'm looking at how people are sitting, how
mm,
people are standing, and then another thing is how people are just bending and picking basic things up. This could be a cup of coffee. This is
mm,
picking a baby out of a bassinet, picking up a
mhm,
diaper, picking up something off the floor. From our hips becoming so chronically weak and tight over years of sitting, they use their neighbor to the north, the low back,
mhm.
goes the disc.
Yeah.
The low back has helped nobody, never in its whole life. The low back helps nobody. The low back has to hold things still, like our spinal cord.
Mhm,
We don't,
mhm.
you don't want to move, you don't really want to move the spine that much. That's what the shoulders and the hips are for. but those become very weak and tight from too much sitting. So the spine ends up doing a lot of work it doesn't want to do. And that's how we have patients.
Keeps that keeps you in business, honestly,
Yeah, but
unfortunately,
yeah, yeah,
right?
but I call it, but I tell my patients, it's kind of like a stupid practice builder,
Yeah.
right? So I lose nothing by teaching people how to stay out of all the orthopedic offices.
Yes, yes.
Spine pain is the number one cause of cost and disability in the United States at
Wow.
over $100 billion a year.
Wow.
There's plenty of patients. I can teach all of you how to pull yourselves out of the orthopedic rabbit hole.
Yeah. Yeah. And it's that kind of thing where, you go to a surgeon, you're looking for surgery, and surgery is really difficult. Recovery from a spinal surgery, recovery from any kind of surgery is really intense, from the anesthesia itself, even, right? So, but again, because of the culture being more disease biased versus prevention, you're talking about something that people do all day long, right? And again, not sexy. Like there's just nothing so sexy.
Sexy? I think it's sexy. So, it's like in the we are facing this now, like in the, I don't know, 40s and 50s, where people wake up one day and like, oh my God, I'm getting old. And I'm like, ah, I've been waiting for
Mhm.
you. You have to get to a point where I call it good 40 and bad 40, good 50 and bad
Mm,
50. Patients who have, they've had the Kool-Aid. My patients are fine.
yeah, yeah,
5 years, 10 years, 15 years. I have 17 years of clinical visits now, and my patients who are in their late 70s, they're coming in. How are you? I'm fine. Great, lay down. I'm
yeah,
like, by the way, when you go play mahjong, are you showing off to your friends that you feel fine and you have no aches? And please, are you showing off? Because you're kind of cool.
yes, yes.
It's totally this whole thing of aging and feeling pain during pregnancy or postpartum or losing your body or getting arthritis, and no, it's nonsense. It was all preventable the whole time.
Yeah, yeah. I think that's the part that's blowing my mind. I right now is this whole idea of what stories we tell about it, to almost kind of like excuse the lack of like preventative
Yeah.
care. I'm sorry. I'm
Yeah.
just. It's like in the middle of this idea of like you just we're sold on it that this is going to suck, this is going to suck, this is going to suck, but we don't really talk. Then there's never like a second part. But could we make it not suck? Like how could we keep you from being there? So I love a lot of the blue zone work where they
Yeah.
go to those different places, or where there's the more of the octogenarians, and looking at their activity level and like what they're eating and how they're living. Squatting, how do you feel about squatting?
I mean, if you have any hopes of getting on and off the toilet, we need squatting.
Yeah.
It's see,
Do you feel? I
I
mean, do you feel like
yes, you
it's
have to.
bad for you? Like it's is it because there's
No.
a lot of I'm more familiar with a lot of more of the Asian kind of like areas that has, and they're finding that a lot of Asian cultures, they squat more often, more readily, all the time, whether it to be doing, cleaning the floor, to eat, to, just sitting to poop, right? Because they're
Yes.
sometimes
Yeah.
pooping like on a toilet that's in the ground, which means that
Hmm.
you're squatting on that
Oh yeah.
that
Yeah.
so we have hence the evolution of the squatty potty, right? To take a Western toilet and give you the same
Yeah.
feeling. But something the reason why it's fascinating for me when you look at other cultures, it's because we are all humans. We all kind of have this silliness where we're like, what we see around us becomes accepted as like what we that's just how it is. It's very similar to how this culture, we're more disease based. Prevention is like, right? We want sexier. We want, prevention just doesn't have the same ring to it, right? We talk a lot more of like some fancy drug or surgery that came in to save the day. In countries that don't have as many bells and whistles, right? You know, they very much will list out to you at even 30 years old, at 40 years old, 15 things that they do every day that maintains their health. Eating is not just what do I crave? What am I feeling like? They're like, what do I need? Do I need a little bit more fiber today? Did I eat enough protein? They're looking at it as a treatment, as a way
Yes.
to kind of like take care of their
Yes.
body, um in a way that we don't do that, right? So I think
Yes.
squatting is one of those things. As I thought about it, these people are not squatting because their trainer at Crunch down the street in Okinawa was like, you need to do
I
your
know.
squats today, right? They were like,
I know.
that's how
Yeah.
I am when I'm washing my clothes on the do you know what I mean? It's like they're like, you guys are talking nonsense, because in their world squatting is the way that you sit, you are, right?
Yeah.
and
But we
and
only do
that's
everything in
right.
extremes.
Yes.
Americans only do everything in extremes. And I think about that a lot because my patients ask me for exercise recommendations with regards to accommodating whatever their today years old body is. And when I look at things I have done personally myself
Yes.
versus how I work out today versus how I work out 10 years from now, and I think about how the seniors stay active in
Yeah.
Japan
Yeah.
and how I stayed active when I lived in Italy, this extreme, like, must kill ourselves with burpees and must work to the extreme to destroy my body because that's the sign of health. That is very American.
So
That is
American.
that is
So
very
American. And
is
this is the
very,
thing.
very
Yeah.
American.
I mean, I can't tell you how many friends of ours, I'm in my 50s, that were like, became like marathon runners, like at 40. And I'm like, I'm going to do Ironman starting
I
at
know.
40. It's not like they had spent their entire life. And listen, power to you. But the injuries they'd incurred over those times were
Yeah.
pretty intense, really intense injuries,
Yeah. Yeah. I'm 45. I will do like interval running and some weightlifting 2 to 3 days a week. And I stay active with other sports and activities. And I have now
Yeah.
designed my entire life around physical activity. I call
Yeah.
it incidental exercise.
I love it.
Uh, I I don't train as hard as I used to, but I
Yeah.
still have very good muscle mass and endurance and
Yes.
power. But anything I do forever, any sort of exercise, the first thing I say is this safe?
Yeah. Right. Right.
Is this,
It's,
yeah.
yeah.
I have a
Yeah.
saying, just because I can doesn't mean I should.
Yeah, that's fair. That's fair. And I mean, I wish my friend who was 40 at the time playing basketball with a bunch of 25-year-olds and fractured his femur, which is kind of a big bone to fracture. But it was the kind of thing where it was like, what business did you think that was, like, how did you think that was going to turn out?
I know. It's the
It's a
American,
really,
it's the American body culture that we have here right now. As you know, we just swung back into extreme thinness, Americans. We have
yes,
swung back in. We swung. We were like the 80s and 90s wave, and then went to body positivity 2020, and now we swung back into, I'll use a medical term, we cachexic bodies. Like
yes,
it looks like the muscle wasting illness.
right.
We do everything with extremes here, and then
Yeah.
the Italians are walking.
Yeah, let's
Like
just, right. Let's do that. So let's say, you're looking at a person, they're coming into your office, we go over sitting, we go over standing,
yes,
right? We kind of
and
go
bending.
over and bending. So those
Yes,
are three things: sitting, standing, bending. That's great. If you are pregnant, you're going through a pregnancy, right? What are things that you should be doing? And I love this idea of, like, what did you say? Incidental exercise, right? And so this idea of weaving in to your daily life, things are not like, I have to like do these, I have to go to this gym that's like half an hour away. Like, we're talking about, like, what do we do, right, that can fit into your daily life, daily, everyday life, right? Where you are helping your body adjust and go along with this ever changing thing coming out of your belly. you know your ligaments are a little loose, right? So definitely there's some risk for injury, right? So we're really, and there's some people who were very active before they had babies and they get pregnant and they maintain the activity, but for kind of the average person that had some activity, but they want to make sure that their body is still taken care of while they're pregnant, what are some activities that you recommend that are healthy for a body that's going through that change?
So I would say, there's a couple options there. So number one, the single most important thing that you can do is what I already described, which is the active sitting and sitting with your body in some sort
Okay.
of good neutral
Yeah.
and bending. Think about how many times a day you go pick up keys, pick up a cell
Yes.
phone, pick up your purse, picking up a laundry basket off of the floor. When
Yep.
you're doing these things through your hips and pelvis with good integrity, you're getting deadlifts in, you're getting squats in, you're getting
Okay.
basic incidental safe exercise in. So I have a book that will be coming out. It's called The Other
Oh,
23 Hours because it's not the 1 hour that you're doing Pilates or physical
wonderful.
therapy. It's the other 23 hours of what you're doing with your body.
That's it. I
Because
love that.
as you probably already know, they did another good study that was published in JAMA. I think it was 2018 or 19, where they came out with
Mm,
the gold standard of treating back pain. And it turns out there is no one best therapy. They all work. What is the best? What is the best? The answer is pick something that you like because they all work temporarily. I'm
mhm.
very invested in the other 23 hours. So you
Yes.
think what can somebody who is going to be pregnant and currently pregnant, um, the act of sitting with good posture at the tip of the chair, bending with good integrity through the hips, not the back, bending and lunging. These are just like basic human activities. Okay, here's some other things I love during pregnancy. Swimming, if you have access to a pool. What I did for my first pregnancy that I thought was going to be an awesome, super fit CrossFit pregnancy, and then I felt like a pregnant water buffalo that couldn't move. I lived in the pool and I didn't want to get
Yeah.
my hair wet, so I had the kickboard and I would kick, 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 kick. I left little weights in the shallow end. I did some
Yeah.
arms. I did some push-ups. I also like it because it gives an opportunity for the baby to float up off of the pelvis and
Hmm.
work on positioning.
Nice.
So I love swimming for pregnancy. I'm very partial with all joint and spine and everything rehab on a system
Yes.
called foundation training. And that helps to build the pelvis and the spine. That's a good basic type of exercise. You can check them out free on YouTube.
Okay.
And I like that better than I'm a yoga teacher that owns a yoga center. I like that better than the yoga and the Pilates and the it's a good, very gentle, non-impact exercise system for the spine and the hips.
Oh, that's wonderful. So you birth a baby, your body still is not quite yours, right? Takes quite a while for the body to equilibrate, fluid to shift. You have a partner who is also taking care of the baby, right? So I saw my husband literally throw out his back because he
Yes,
thought he had hips. He doesn't
correct.
have hips. And just that standing where you were like uneven, you're trying to do that to hold this baby. And one day he just couldn't move. So knowing that all of those, and I love that this other 23 and this whole, because again, we're so focused on like, I did 1 hour of exercise, that's enough for my life. And it's just like, no, you got to make sure that you're paying attention to where your center is, where your body is always. Kind of like even this idea of paying attention to your breaths, right? Like we take it so for granted, but it just changes the flow of like our body, like, being able to kind of do that. So the way you stand, I'm going to keep on saying it so that people can hear it. So the way you stand, the way you sit, and the way you bend are all things that actually, can either tighten your axis. It feels like it's almost like an axis, like trying to kind of keep your center right in the right place, right?
What do we want in the body? We want balance.
Yeah. Yeah. And
We
you
just
can
want
right.
we want balance in the body so you don't get compression and dysfunction in one area. It doesn't matter what it is. We want balance. We want balance in the body.
Yes.
So that, like I said, that cannot be accomplished in 1 hour of physical therapy, 1 hour of Pilates, one chiropractic adjustment. These are all temporary approaches
Yes. I love it.
to feeling good, whatever the intervention is. and it matters much more how we hold ourselves the rest of the day. And if you're sitting with your legs crossed in front of a computer, you're gonna get
Yeah.
sciatica. You're gonna have sciatica. You're gonna have one tight hip that turns into a hip replacement when you're 75.
Yeah. Yeah. Balance. Balance. And then you were saying something about when you are bending to not to use your legs. People always say, like, lift with your legs, like, to, not just put everything to your back, I assume is what you're talking about.
Right. So they say use your legs and squat and squat and squat, and these are the knee pain, knee replacement patients.
Okay.
So
Okay.
I'm more of a deadlift kind of person.
Okay. Okay.
It's called a hip hinge, where you
Great.
have your feet lined up evenly like skis, and you don't use your knees. You allow your hips. It's almost like a children's
Oh,
teeter-totter. You allow the
yes.
hips to drift back, so you start to use the hamstrings and the glute muscles.
Oh,
These
yes.
these are big, meaty muscles. They should be doing a big job.
Okay.
So I'm more partial to a hip hinge that uses the hamstrings, the glutes,
Yeah.
to ambulate and move the body instead of the low back, where you
Mm,
bend and open, and one day, like a copper wire,
okay.
it
I'm
breaks,
gonna
it
practice
breaks.
that. I'm gonna keep trying to
Yeah.
practice that because it's. I mean, who teaches you to bend? Nobody. Like, I mean, honestly, like, nobody.
I think about this a lot because, we teach our kids to brush their teeth from such a young age because when you have unhealthy teeth. You could see it. It doesn't
Hmm.
look good,
Hmm.
it doesn't smell good, but you're not getting prophylactic x-rays of your back, watching your spine rot and degenerate out of your body. And then you go to the
Yeah.
ortho one day, they're like, look at all this
Right.
arthritis. And the patients are like, what? How did it get this way? And they're like,
Right.
oh, it's because you're getting older. And I'm like, oops, hold on. No, no, no,
Right.
no.
Totally. And but I had to say that completes the circle. You have this baby, right? The hope is that you've learned some of these things, sitting, standing, bending, right? Like, we're looking at all these different ways to optimize ourselves. We model it for our kids, right? And we, instead of sitting there and saying, "Oh, I want you to look," right? Because you think, "Oh, it's so nice when they cross their legs and they look so polite," right? That's not
I
so good
mean,
for their
yeah.
back.
Yeah, I mean,
It's.
with the kids, it's more iPad use.
Okay. Yes.
That's where I become a little
Right.
more
Right.
involved with kids, which is they're all sitting like this all the time. And this is the first generation of children in a pediatric population that I'm treating that grew this way, not this way.
Mm,
So I,
yes.
I joke that our generation, we grew up straight and we got ruined later. That's somebody I can
Yes.
restore. But this is the first generation of patients I have ever had that grew up shaped like a C
Okay. So
from digital
from
technology.
digital technology. So does that mean? I mean, kids are on iPads. They're on devices. What do you recommend for
So
optimal? Yeah.
I can actually send you. I made an iPad guide, and
Yeah.
I call
Yeah.
myself I'm mean mommy. I'm mean mommy about two things: brushing your teeth, and if you're holding a digital device, you can hold it in one of three ways, which
Okay.
is propped up on your knees,
Hmm.
propped up on your knees,
Yeah.
propped up on a pillow, or they have to be on their belly like a surfboard in extension, watching.
I mean,
But
we can use that too, right? Like, we should be doing that too, right? So that we don't
yes,
mess
everything
ourselves
doesn't
up,
break.
right?
Yes, yes. If you don't want to be a forever orthopedic pain patient,
Yeah.
you got- you gotta get, yeah, you have to get yourself, you have to choose. You have to choose as adults. We have to choose. We
Yeah.
pick.
And it's a kind of thing where it goes back. I really love your title of your book coming out,
Thank you.
right? The 23 other hours, or how is it? Is the other
Yeah,
23.
yes, it's called the other 23 hours,
Oh,
which is how to sit, stand, and move your way out of pain.
yeah. Love it. Love it.
Thank you.
Perfect. Thank you so much, Dr. for sharing this field that I think for some people may not understand, but in many ways, like, your care has been around for a long time. We just forgot about it in modern day world. And it's important for us to understand that it's not just about the pregnancy even. It's about the 10 years before and the 10 years after. So,
Definitely.
seeing things in a longer level versus singular moments, I think can help all of us stay healthy, be healthy in a true way. So I appreciate that. I
Yeah,
have
thank
three questions for you that I like to ask all of my guests. So the first is, what is something that you've done for yourself, and when did you last do it?
Oh, so now my son, Bo, who is your patient,
Mm-hmm.
he is 5, and now I just made it out of what I call like the baby toddler phase. So once you have kids that can like feed
Yeah.
themselves and wipe their own butts, it's like a whole different, it's a whole
Yeah.
different life. It's so different than the nursing
Totally.
and the co-sleeping. I was all in. So now I'm like, okay,
Totally.
guys, you're good. So I started horseback riding again.
Oh, brilliant.
So I now
Yeah.
now that I have time, I made a group of friends, a whole bunch of other moms and professionals, and I'm gonna go again this Sunday. We go trail
Yeah.
riding in the forest in Davie, Florida, and outside of the fact that I resumed a childhood passion, a childhood activity that gives me so
Yes.
much joy.
Yes.
It's not tied to my business. It's not tied to my
Oh.
health. It's not tied to, I just
Oh.
do it because it's fun and gives me a lot of joy because one of the of the many missing ingredients for a healthy mom in today's society is we stop doing anything joyful and we're burned out on the grind, which is working and contributing resources to the family for the first time in human existence.
Hmm.
We are wanting to be home at 2 o'clock in the afternoon to do pickup line and make cookies and be attentive parents and not be workaholics. And then we have to be skinny. So right. So it's like, so I think that we have been trained to think that taking a Pilates class and having a glass of wine is self-care, or getting a manicure, like basic self-care things, like, oh no, she's fine. She's bathed. So
Yeah.
she has no, that's not self-care. Self-care is a dance class, an art class,
Yeah.
music, sports that are not for your fitness, just for the sheer joy of movement. I'm a surfer as well.
Hmm.
So that's
Hmm.
something that I've added back is just for the joy of being alive, not taking care of something or adding resources to the family.
Yeah, that's wonderful. I think that we don't realize that, it's quite numbing to our brains to have children, frankly. And it's kind of nice when the neurons are firing again on something that we're actually interested in. And that piece of our life before we had children becomes like a little bit of a lifeboat for, as we can place it back in to remind us, hey, this person is still here. They're not completely numbed out. Your brain can still very much work. Particularly with horseback riding, that talk about posture. You really have to be in a good space posture wise, and also connecting with a being, with an animal, really focus you to be present. Otherwise you're getting thrown off this horse. I mean, you're not paying attention, distracted. This horse can tell, and things will happen that are actually dangerous. So requiring it on that level, I think, is something that, we were just talking before we came on, this idea of the multitasking, and just being present is such a skill set. It's so difficult to do, and I love those activities because they require you to be present.
Very much.
So that's pretty awesome. And then the second question is, in the idea that our children are born the way they are to heal the family, what is one way that your children have healed you,
Wow.
amongst many?
So yeah, it's hard. I was thinking about that question a lot, like just in the last week. Um, I mean, the first thing is just even getting to know them as their individual beings. They come out how they come out. I'm just so delighted to get to know who they are. They wake up a different person every single day. Every single
Period.
morning they wake
Yeah,
up, and I'm
absolutely.
like,
Yeah.
please, you like I know their brain developed overnight. They open the door. I'm like, who's coming out today? A different person every day. So how have they healed me? So I was my own person before I had them. I think I had Sage at maybe like 35 or 36. So I had like this
Mm-hmm.
well entrenched like belief and experience of living my life as myself. And having a baby and living that postpartum and becoming a mother, especially of babies and young children, I think about this a lot. Outside of maybe a chronic disease, that is going to be the most vulnerable years of your life.
Yeah.
And you are going to meet the outer boundaries of your character that you would not have met otherwise.
Mm-hmm.
And having walked that walk twice, and meeting those parts of myself, and knowing what I want to take and what I want to leave behind,
Mm-hmm.
and what I am willing, what environments I'm willing to put myself in, and the people with whom
Mm-hmm.
I'm willing to surround myself, not just so that I can feel well, but that I can be the best mother possible for these two
Mm-hmm.
beautiful children.
Mm-hmm.
They've really given me an opportunity to, I guess, grow into the version of myself that I like and can be proud of,
Mm-hmm.
and that I feel is going to be a good mother for them. So anything I might have been flexible on before, just because
Mm-hmm.
I was younger, maybe a little bit more
Mm-hmm.
moldable. It's gone.
It's gone. Yeah, and I think that resolve is something that I love. They often say in pediatrics, the kids are great, but the parents are awful. And I always
Mhm.
disagree with people when they say that because I'm like, I came for the kids and I fell in love with the parents. And I say that because what you're describing, that resolve of like, if I said, like you said, you were young and you're like, I'm not going to really deal with this. You have this kid, there's a mirror that gets placed in front of your face, and there's a choice you have. And you can either continue dysfunctional behavior, dysfunctional habits. You can embrace things that are fantastic, but it is a moment in time where you are literally challenged to become a better self, to become a better you, and to rise to challenges that you would have been terrified before for yourself. But with this motivating factor of being there as a parent, you rise to that challenge. And as a physician, as a pediatrician, particularly, to be able to bear witness to that growth, to that expansion over and over and over again is just so incredible because we don't realize how that happens and when it happens, but it happens.
Mhm.
So I totally agree with you, and I think that's really is the beauty of having children is going through things as opposed to avoiding them, which is what we often do before we have children. We don't have much of
Yeah.
a choice when we have them.
I think of the jump. I think of the jump, the change in a woman, what they say, from maiden to mother to matriarch.
Ah, that's fascinating. Yeah.
The like the wisening and the
Yeah.
ripening of a woman in the tribe, and shedding those dead leaves and those
Hmm.
movable, I hate the overused word on social media, boundaries. I hate that word.
Yeah.
But the
It
malleate,
is.
the
Yes.
malleate, the being the pinata.
Yes. Well, the
You
people
lose
pleasing,
that.
unfortunately,
I
is
call it the
so
pinata.
pervasive. Yeah, fine. That's exactly what it is. And you start to
We're
realize,
groomed. Yeah,
we're groomed.
we're
Absolutely.
groomed. We're groomed to be a
Yep.
pinata. People are they want to smack you,
Hmm.
and they want candy to fall out.
Yeah.
And then, right? And then there's like a broken pinata on the floor, and people are like, "Oh my God, she's burned out."
And it's wild. And it's that kind of thing where you like put yourself back together and you're like, that's not happening again. Like we're not doing this again.
Well, that's my
And
hope. That's my
yes.
hope. I know that's what's going to happen. Like Sage is going to be 10 this month.
Amazing, right?
And so I have
Amazing,
a
right?
10-year-old, you're crazy, a 10-year-old.
Yeah.
So I know that because of these discussions that are going to be disseminated into digital media, the
Right.
life for the daughters now when they are grown, it's not even going to slightly resemble
No,
the
no.
work life experience that our generation of mothers is having because
Yeah.
my daughter, the kids who are going, they're not going to be pinatas. They're
Yeah.
not going to,
Yeah.
they're not. So what I hope is that they will learn that everybody gets to eat at the table. Nobody
Yeah.
gets smacked around by a pinata.
Yeah.
Like a pinata was hoping that candy falls out and then wondering why the woman is looking and behaving all
Yes.
bashed up after. And they're like, oh, she's, crazy. And we're like, I don't know. She's
Right.
been,
Right, and the Kool-Aid of like, yeah, it's supposed to hurt, sorry, we can't do anything about it. Yeah, it's gonna hurt. It's,
oh,
this is everything is, and it's a kind of thing
yeah.
where yes, there is some of that anticipation, and I understand that idea of trying to make people feel, and there's an inclusiveness to like everyone kind of going through something, but at the same time I really wrestle at this idea of like of everything being a foregone conclusion. I get very kind of angry about that as someone who wants healing. A foregone conclusion means you have no right to demand change, and that you just have to kind of deal with it. And
Yeah. It was like
we,
that before. But
mhm,
women,
yeah,
we have a platform to connect with each other now.
yes,
I
yeah,
always say when I see like these explosively equalizing thoughts coming out on social media and women are
hmm,
typing away and they're like, "Oh my God, me too, me too." Oh,
hmm,
these are not isolating one-off situations. What you're describing, the foregone, like, oh well, this is how things are. You know what? It's finished.
yeah, I agree.
It's
But
over.
the advocacy part of it is really compelling, and really amazing. I love that part,
It's
because being
it's
able to
finished.
speak each other and validate each other's
Yes,
truths is, once you break
yes.
that shell, then the rest will come. The
The
solutions will
the
arrive.
the women are talking.
Yeah,
It's
yeah.
over.
And so
It's over. The women are talking. It's finished.
I love that. I love that image for some reason. And so the third question is, in the postpartum period that you were alluding to, what is something that your village
Hmm.
that gave to you that you were like, oh, that's
Yeah.
kind of awesome?
So I had a unique experience for a modern mother that I believe that will become the standard for women 15, 20 years from now. My village was my office. I have my own clinic, and from day one, I earmarked a room and I brought my
Hmm.
babies to work for 2 years each.
Hmm.
And I hired a full-time nanny, Rufina, who was sent
Hmm.
directly from God into my family. I called her
Yeah,
Rufina Poppins, like the most
direct
wonderful.
delivery. There
And
are people in your village like that. Yes.
whoa. And I had a dedicated back room for both of my kids in
Hmm.
my own clinic and with a nanny. And what this meant was I could nurse my kids on demand and see patients every 15 to
Hmm.
30 minutes, poke my head out, mwah, 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 kiss, 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 I love you. And the front desk, the massage therapist, acupuncturist, yoga teacher.
Hmm.
Oh, let me hold the baby.
Yeah.
Let me hold the baby. Let me play. Oh,
Hmm.
patience, patience. Hi, baby. Hi,
Yeah.
baby.
Yeah.
So I had a village of women loving my children,
Yes.
holding them, playing with them. And then I got to do something I am very passionate about, which is seeing patients, working,
Yeah.
contributing to the community outside of my home, and yet being able to be with my children 24/7 with support.
Yeah, yes. So I don't know if we've ever spoken of this, and we may have, but I literally did the exact same thing. So when I started practicing, I literally showed up back at work at 2 weeks with the baby in tow, and they
You
were
like
like,
from the
"Hey,
baby.
they're like, Doc, they're like, why are you here?" And I'm like, "Could you just watch my kid for like an hour? I'll be right back." And literally, because I, seeing patients fed me,
Good.
seeing people. I mean, it's very lonely sometimes being at home, and so I worked with my mom. So I worked with my mom, who was a solo practitioner pediatrician. My parents are both pediatricians. And we had a back room, we had a gate, because those toddlers, they get free. And so literally
Yeah.
my kid would just run around. And then I brought them to a little school starting at like 2 years old. So we kept them for about 2 years.
Yeah.
But those first 2 years were chaotic, were crazy. And I would answer calls while I'm feeding a kid. But literally, they were here with me. I could do my work. I had my mom. Their village was anybody who was around.
Right.
They
Yeah.
were able to like get along with people, all different people. And it was really important for me. I speak about this sometimes, this idea of finding or creating villages and trusting people outside of your immediate family. We're a very nuclear family in the US. And in the end of the day, there's so much wisdom in the world. Let your children experience all these other people. Let yourself accept help, accept people to give it some advice. Yes, there should be, as the word is, boundaries. There are some moments where you don't have to take everybody's advice, but having people around you is not a bad thing. Having children understand that there is a village that loves them is never a bad thing. And to me, it was so wonderful. So I don't know if you saw this, but when COVID happened and people were working from home with their kids, literally doing what we did, where we kind of meshed
Yeah.
it all together, and people were like, this is crazy. And I'm like, but kind of awesome. Like, they were like, it was a very, and I'm like,
Yeah.
yes, like that is, because I was the only one of my friends that was doing that. A lot of people, even my
Mhm.
own mother, who was another generation, thought I was nuts, because she was like,
Oh,
you either work or and have a nanny with the kids
yeah.
at home,
Yeah.
or
Yeah.
you're at home. Like, in her mind,
Yeah.
putting them two together is nuts. And I was like, but I want to be able to see my kids. For me, those
Yes.
first 5 years, as much as I can
Yes.
see them, I need to see them
That's
because I
it.
catch their rhythm. I know a
Yep.
little bit about what makes them happy, what makes them frustrated. I get a lot of information those first 5 years. You're having that experience. I'd be curious with the teenager versions. I found myself constantly referring back to those years when we were kind of intimately working and growing together, because I got a really good blueprint. I got a really good idea of what was some of the foundation of how their brain was working. And that really came up again when they were teenagers and really kind of going through their own growth periods. But I would never give up those years, but I also didn't want to not work. I also wanted to kind of engage with people and like
Yes.
be in society. So to
Yeah.
me, it was the best of both worlds. It was often very chaotic, and I grew to hate multitasking because I felt like I was constantly thinking that I could always multitask. I wish I
Mm.
was a little bit more present sometimes because things did get crazy, but I would never have given any of that time up.
No. If you think about so the stay-at-home mom is vilified. The working mom is vilified. But if you could imagine, I always compare the way that we live now back to the tribal communities of the last 10,000 years of human functioning, probably up until, I don't know, 60 or 70 years ago, maybe,
Right.
which is a birthing mother at some point is still allowed to go out and then cook for the community
Mm-hmm.
and be a medicine woman.
Yes.
And
Yes.
women have contributed to society outside of being a birth portal
Yeah.
for thousands of years. And so I
Absolutely.
considered the yoga teachers and the front desk. These are the aunties.
Yeah.
These are the
All
tribes.
aunties.
These are,
Absolutely.
yeah, if you're nice to my kid, I'm nearby. This is both my kids to this day, I call them the mayors because they talk to everybody.
Yeah.
They're friendly with everybody because my kids have constantly been around loving adults who are good to them.
Yes. Yes.
And
Yes.
again, in my magic crystal ball of what's happening in the next
Mm-hmm.
20 years, I hope somebody hears this podcast and starts a
Mm-hmm.
business.
Mm-hmm.
I think that you are a medical doctor and I'm a chiropractor, and I have
Mm-hmm.
conversations every single day with new moms, lawyer, accountant,
Mm-hmm.
doctor, who are immediately postpartum and going, you know what, I'm having a change of heart. I'm not going back to my career. I want to stay home
Right.
with my kid. and
Right.
then pulling women back out of the workforce and the
Yeah.
contribution that we make. So my hope is that somebody is going to start a corporate and or medical and or legal nanny business.
Yeah.
Take
Right.
and take it and not lose women from the workforce. They take a 10 by
Yeah.
10 room in a large law firm,
Yeah.
and they let a female attorney bring their baby up to 6 months. They can go pump every 2 hours, see their
Mm-hmm.
baby, and not lose women, highly educated
Yeah.
women, contributory women out of the workforce, and not rob them of that intimate time with their babies and
Yeah.
small children.
Yeah. I actually think that with a lot more people working from home, after COVID, frankly, I think a lot of people used to go home for lunch. Men and women used to go home for lunch. Kids would come home for lunch during the school day. So, again, these things have always existed. We think because it's in the last 20 years that it's the way it's always been. Hell no. It's never been like, it's actually
Yeah.
never been like that. And honestly, like with villages, people, some in other countries, again, going back to this idea of knowing what other countries are doing, Trevor Noah talks about being raised and being, there was his mom, but also he got to know his auntie and he would hang out at his cousin's house. And it wasn't because his mom was bad, but it was because he was living within a village and his mom would have time where he was not with her so she could do what she needed to do. It was a situation where there was a certain fluidity that is really missing. And in the end of the day, parents who are trying to literally like hold on to this nuclear family idea where they are the only voices that their children hear are
Mm,
really, missing out, but also looking up and being like, I'm exhausted. I'm so tired. And it's like, yeah, because you're
yeah.
doing what you weren't like you're not
Yeah.
supposed to be the only go-to period for these
It's
kids
it's
for
too much for
everything.
two people. It's too much for one or two people.
Yeah.
We are
No.
we are herd animals. We are clan
Yes. Yeah.
right? It's too much for two people.
No, no, it's too
So
much. So, oh, beautiful. Thank you. Wonderful. Thank you for joining us. Really appreciate it.
yeah, thank you. Can I share how I know you
Absolutely. Go
for your
ahead.
listening
That would be
audience?
wonderful. That would be lovely.
I I would like to share how I know the amazing Dr. Perlman. She was the pediatrician for our two children here in Miami.
Wonderful.
And when you decided to relocate to give your family a wonderful life in New York,
Yeah.
I remember going into panic mode, being like, how could she leave us? And how could she leave? Dr. Perlman, you are probably one of the best diagnosticians I have ever had the privilege of being in
Oh.
consult with. And not just that, you have the intuition and the love and the
Mm,
trust in your parents and in their children that you are a wise wolf in our tribe. And everyone is very
so
lucky
sweet.
to now have you disseminating this information, not just in Miami, but now through the world, because
Yeah.
you are a rare pediatrician
Oh.
among medical practitioners. You've quite literally saved the life of my children on multiple occasions
Oh.
just by you going, I don't see anything here today. I think you should go to the hospital and get this checked out. And it turned out to
Yeah.
be life-threatening conditions just because something inside your body said, I just feel like something is off.
Yeah. It's interesting because my I always tell patients I learn as much from you as you learn from me, which is, really true. Um, I love patients who have an intuitive connection to their children because I know that they are taking care of those children 24/7. And to me, the fact that if I don't listen to you, that means that you don't listen to you. Does that make sense?
Yeah,
And that is me cutting down a flow of information that is priceless. Right. So to
yeah,
me, a lot of
yeah,
that intuitive thing was me optimizing care because if I dismiss you, that means that maybe 2 hours, 3 days, a week, a year, something will happen. And intuitively, you feel like something's wrong. If you've always been dismissed
Mm.
and you haven't grown a sense of intuitive connection and confidence in how you know your child, it is a missed opportunity, right? It's a missed situation. So I appreciate all the accolades.
Yeah.
But for me, being able to work with parents who are thinking, of course, I always knew from the beginning, and I'm going to get a little teared up because it's been 25 years of like being, is I remember this phrase. I remember sitting in my mom's office and my kids were like 1 years old, just like literally like, and I had this like moment where I was like, I want strong, confident parents. I don't know why that just that phrase. And I was like, I will do whatever it takes for me to grow strong, confident parents. It wasn't even like, I
Mm.
want all the kids to be healthy. I know health issues come up,
Mm.
right? So I can't provide that, like I'm not
I love
God in that way. But what I do have power in is how
mm.
strong and confident a parent is. Because if a parent is strong and confident, I will have healthier children.
Mm.
And the more that I can feed that strength, I can feed that confidence, my
I
job's
love it.
easy, right? My job's
Amazing.
easy. So
Mm.
right
You're
back at
building the
you.
gardeners. I love
Yeah,
that. You're
right.
you're bolstering the gardeners for the
Yes,
flowers.
right, right.
Oh,
Because that's so you just described what I would my dream. That's what I want, right? Is that idea that like you are connected. So bravo.
yeah.
Well, thank
Thank
you
you.
so much, Doctor. And then, please we include the links and all the different information, your website and everything like that. And, we'll definitely speak again as we find more topics about because we need to keep learning. Remember,
Okay.
sitting, standing, bending. That's it.
That's it.
Thank you.
That's it.
That's it. All
Thank
right.
you for
Thank
having
you.
me today.
All
Take
right.
care.
Take care.
Bye,
Bye
Doc.
bye.